플러그인 앤 토크 특별 강연을 시작하도록 하겠습니다. And now we'll begin the stroke lecture. 인구 구조의 변화와 새로운 비즈니스 기회라는 주제로 압둘라만 엘 사이드 콜롬비아 대학교 전염병리학자를 무대로 모시겠습니다. 박수로 맞아주시기 바랍니다. The lecture is about changes in demographic structure and new business opportunities. Please welcome Dr. Abdulrahman El Sayed, social epidemiologist of Columbia University.
First, I'd like to thank you for having me here. Me, along with the rest of the SNS team, have been absolutely honored to be here. It's a wonderful production, and it's an absolute opportunity to be educated by so many top leaders across a number of different fields. I'd also like to reiterate the message of sorrow on behalf of the entire SNS team, as well as the people of the United States. As a health scientist and a physician, hearing about the unnecessary early loss of life is something that's painful, something that we spend a lot of time thinking about and trying to delay. So in that respect, I'd like to start then with the talk, thinking about what it means to prevent disease on a broad level with respect to what we see happening in South Korea. So I'm an assistant professor at the Department of Epidemiology in the School of Public Health at Columbia University. Public health is what we as a society do to prevent and promote people's well-being. We'll talk a little bit more about that. But I want to talk about some opportunities that business leaders have to invest in public health, not only to do good, but also to do well. Mine is a story of change. So I want to start with a question. Who knows what this picture is? Anybody? I need to see some hands. Any hands at all? No? Okay. So this is a northeastern word perspective on what is now modern Seoul. But that's in 1966. A picture in 2005 looks a lot more similar to what we now know as Seoul. What you're looking at here is the Dongho Bridge from the perspective of the UN village. It's just southeast of downtown Seoul. Now, with changes like this, come profound changes in the lives that people lead, and ultimately the diseases that they get, and ultimately the ways that they die. And that's what I spent my time studying, with the goal of trying to understand this so as to intervene. And what we see with development is that as a country develops, you see this stark increase in the life expectancy in the first $10,000 increase in GDP. After that, that increase starts to slow down a little bit, but continues. Okay? And here you see South Korea doing rather well at about $20,000 per capita GDP in the year 2000. Now, what happens to people's lifestyles, their health, throughout this? Not only do you see an increase in life expectancy, but also you see a change in the types of diseases that people end up acquiring, and ultimately the diseases that take their lives. What you see here are three different panels. Okay, on the top panel, you see the proportion of deaths across age in high-income countries. Here you see middle-income countries and low-income countries. And what you notice is the color is shifting. Now, what do these colors tell us? This gray here is communicable diseases. Diseases like cholera, flu, pneumonia, tuberculosis. And these green diseases here are what we call non-communicable diseases, things like diabetes, cardiovascular disease, and stroke. So what happens is, as a country develops, when we move from low income to high income, you see a decrease in the proportion of deaths to communicable diseases, decreases in the proportion of deaths to flu, to pneumonia, to cholera, tuberculosis. And what happens is rather that people start to die of other diseases, cancers, diabetes, cardiovascular disease. Now, this is a generalization across the world. We can ask the question, does the pattern hold in Korea? Now, asking this question in Korea from a scientist's perspective is actually a rather unique opportunity. Why? Because you have somewhat of a natural experiment. After the division of North and South Korea, we see two different Korean populations, populations that genetically are no different from each other. The only difference is that one has developed profoundly, and the other one stayed rather consistent with where it was at the formation of the state in 1948. Okay? So what you see is that South Korea's
보시는 것처럼
GDP
한국의
has increased,
GDP는
whereas North
시간이
Korea's has stayed
걸릴수록
flat.
성장을 했고요.
Now, what
북한은
implications does that
동일한
have
수준입니다.
for life expectancy in either of
이게
these
평균
two
수명에
countries?
어떠한 영향을 미칠까요?
And what you'll note is that there's a 10-year gap
보시는 것처럼
in the life expectancy
남한과
of
북한
people in
간에는
North Korea
평균
and
수명의
South Korea. Now, I want to
10년
note that the
차이가
life expectancy in South Korea is among the highest in the entire world
평균 수명은
at 79
전 세계
years.
굉장히
Okay?
기준으로 봤을 때 굉장히 높습니다.
But not only that,
70%죠.
we also see differences in the types of
평균
diseases
수명에서만
that
차이가
people
나는 게
die from.
아니고요.
What you'll
이
see here
사망의 원인
is
질환을 보면 또 차이가
the
납니다.
top 10 causes of death in South Korea
보시면은
compared to the
왼쪽에서는
top 10
한국에서
causes of death
사망을
in North
초래하는
Korea.
상위
Now, if you remember
10대
what I told you
질환이고
about the types of
우측이
diseases
북한입니다.
that people die from following development, you should remember that the
경제
big difference
발전이 있는 국가
is
같은
that as countries
경우에는요.
develop,
예를
we
들어서
see a
국가가
decrease
발전
in
과정을
deaths to communicable
거치게
diseases.
되면
What does
우선
that mean?
전염성 질환으로
Well,
인한
when we
사망이
look
줄어들게
at these two
됩니다.
different lists, you'll note
이 두 개의
that in the
리스트를
top
한번
10 causes of
봐주세요.
death in North Korea, we still
북한의
see
상위 10대
substantial
질환
amounts of
보시면
death to things like
여전히
influenza,
독감이랄지
tuberculosis,
그리고
and other lung
결핵,
infections,
그리고
which
폐감염성 질환
have
이런
all
것들이
become
상위에 있습니다.
relatively serious but
물론
treatable
이런 질환은
diseases in
물론
the South.
심각한 질환이지만
And when we
한국
think
같은
about the
경우에는
mechanisms that
치료
produce
가능한
this,
질병입니다.
it's things like improvement in sanitation.
우선 이것은 위생이
It's
개선되기
things like
때문에
decreasing overcrowding in
그리고
the home.
또,
And then also the provision
뭐
of
인구
medical care and
밀도는 물론
vaccinations.
높지만 그래도
And so you see
모여 사는
what
사람들이
generalizes
그리고
across the
또,
world taking place right here
예방접종이
in North and
있다랄지
South
이러한
Korea.
변수들에 기인해서 차이가 나는 것이겠죠.
Now I want to take a focus on South Korea.
그러면 이제는 한국을 비춰보도록
These are the top 10 causes of death in this
대한민국에
society.
있어서 사망
I want to go
제10대
through them
원인이
and
여기
explain
나와
what they are.
있습니다.
Stroke,
질병이죠. 우선 맨 위에
which is what
보시면
happens when the
뇌졸중입니다.
brain loses access to its blood supply.
뇌졸중 같은 경우에는
Coronary heart
산소를
disease,
공급하지
what happens when the heart
못하는
loses
상황을
access to its
합니다.
blood
그리고
supply.
또한 심질환 같은
Lung
경우가
cancer, the
2위입니다.
invasion of particular cells into the lung
폐질환,
that grow and continue to
폐
multiply,
암이죠.
taking over
그래서,
tissue that was once healthy.
폐에서 암
Diabetes,
조직이
an imbalance
증식하게
in
됩니다.
the sugar,
암세포가.
such that
그리고
you have
또
increased sugar in the
당뇨병
blood,
있습니다.
but that the body can't see
실제로
it.
혈액에서의 당 수치가 높아지는
Stomach
겁니다.
cancer, very similar to lung
그리고
cancer.
위암,
Suicide, which goes without
폐암과
explanation.
유사합니다. 그리고 자세한
Liver
거
cancer,
아시겠죠? 또
road traffic
간암,
accidents,
그리고
colon cancer,
교통사고,
and liver disease, cirrhosis.
대장암,
What happens
그리고
with an increase in
간
alcohol such that the liver
질환입니다.
becomes
간경화랄지,
hard and stops working.
과도한 알코올로 인해서 간이
I want to
제대로
take a focus on
기능을
these top
못하는
four.
것이죠.
Arguably, if we were to address the
상위
top
네
four
개만
causes
보도록
of death in
하겠습니다.
Korean society,
한국
we could do something
사회에서
meaningful about health and disease in this
사망을
particular
초래하는
population.
이 네 가지
Okay?
주 질환을
So let's
한번
ask a couple
살펴보도록
questions here.
하겠습니다. 그럼 이것과 관련해서
Stroke and
구체적인
cardiovascular
질문을
disease.
해보죠. 뇌졸중,
What
그리고
causes strokes and
심혈관
heart
질환
attacks?
생각해보면
Well,
이 심장마비,
it's a process called
그리고
atherosclerosis.
뇌졸중을
Okay, and just to
발생시키는
break this down,
것이
what you see here
무엇일까요?
is that
서로
you see the
동맥경화입니다.
invasion of the inner lining of important arteries with cholesterol. Okay, and that does two things. Number one, imagine if you're invading the inner lining of a cell, of an artery with cholesterol, you're decreasing the bandwidth of that artery. It just can't move as much blood as it used to be able to. But not only that, is that cholesterol starts to break down the lining, and whenever blood sees tissue that it doesn't see as the inner lining of an artery, it starts to do what? What happens when you cut yourself? Everybody here has cut themselves. Come on now. Blood clots. Now, what happens is you form clots that then push into the tissue. Now, when this happens in the heart, it causes heart attacks. Why? Because for a moment in time, the heart loses access to blood. Blood does a couple things. It carries glucose, it carries oxygen, right? And when tissue doesn't have that, it starts to die. And that's what causes heart attacks. The same exact thing is what causes strokes, but in arteries that feed the brain. Okay, so a stroke is probably better named a brain attack. Okay? So those are the top causes of death in Korean society.
이것이 한국 사회에서의 주
Now,
사망 원인이죠.
Let's take this a step further. What causes atherosclerosis? It's not that simple, right? We can't just say it's atherosclerosis and done. Let's try and think about things that we can intervene on. So what causes atherosclerosis? Well, hypertension, high blood pressure, high cholesterol, and obesity. Let's take a step further. What causes hypertension, high cholesterol, and obesity? Well, things like smoking, poor diet, low physical activity that I've demonstrated here by a glut of cars on the freeway because people are in their car instead of walking. And then lastly, even the particulate matter in the air. How much solid matter is dissolved in our air that we breathe regularly. All of these things cause the risk factors that ultimately lead to atherosclerosis. Okay? Let's move further down the list. Lung cancer. Okay? What causes lung cancer? Here I show you a panel from a study. It's actually a rather old but blockbuster study. And what you're seeing here is the population of women who die of lung cancer across smoking status. Now, the only women who actually smoked in this entire study are these women here on the left. Okay? They're the ones who smoked. But then you see this other group here who also had increased risk of lung cancer mortality, even though they didn't smoke. Now, what's special about them? They're people who lived in a house with a smoker, and therefore smoked by proxy of the smoker in the house. Okay? And then here you see lung cancer mortality at baseline among people who have no systematic exposure to smoking. All right? Ultimately, what you should glean from this is what epidemiologists call a dose-response curve. Okay? The higher the dose of smoking, the more lung cancer mortality you see. Smoking causes lung cancer. Smoking is the main driver of lung cancer mortality in almost every society in the entire world. And lastly, diabetes mellitus. What causes diabetes? I'm going to show you a very simple slide now. Here you see diabetes risk, okay, among obese adults and non-obese adults in the United States. 21 divided by 7 is 3. Okay? That's 3 times higher risk for diabetes among obese individuals versus non-obese individuals. And again, the main driver of diabetes mellitus in almost every developed society is obesity. So, we know that stroke, heart disease, lung cancer, and diabetes are disproportionately responsible for death in South Korean society. We also know, though, that smoking is a main driver of stroke, heart disease, and lung cancer. We know that poor diets are a main driver of stroke, heart disease, and diabetes. And we know that low physical activity is a driver of stroke, heart disease, and diabetes. All of these causes of death are only proxies. In the end, the only reason causes of death are useful, right, is because they tell us about the risk factors for death. So, let's just drop the causes of death out of the equation entirely. In the end, what drives mortality in South Korean society are these things: smoking, poor diets, and low physical activity. And it's very similar to what's going on in my country, just on a much bigger level, the United States. We see substantially higher rates of some of these things. Now let's talk about what this looks like in South Korean society. First, smoking rates. Now, I know smoking has been taken a big role in the public conversation in South Korea, and that's well and good because it ought to. Because I'm going to show you a slide that tells us something about smoking in this particular society. Here you see rates of smoking, okay, in 2009, put right next to the price per pack of the most popular brand of cigarettes in a society. And most of these countries are OECD countries, so very similar developmentally in terms of economic development to South Korea. And what you'll note, unfortunately, down here at the bottom is South Korea, with the world's highest, one of the world's highest smoking rates, and definitely the highest smoking rate in the OECD. Okay? And right next to it, you see that the price per pack of cigarettes is almost a third that in the next highest country. Are those things connected? Absolutely. When cigarettes are expensive, people don't buy as many cigarettes. When cigarettes are cheap, people buy more cigarettes. It's a simple supply and demand. I'm not the economist here. We'll talk to others. But my basic understanding says that when this is cheap, people smoke a lot more, and it bears out here in the data. Okay? So we have a smoking problem here. A very, very serious smoking problem. That's why lung cancer is the 4th leading cause of death in this society. Now, I was going to do an exercise, this is something I do in my classes, to actually get people to raise their hands if they smoked. I'm not going to do that, right? But I'm just going to say that if you do smoke, you need to really consider what these statistics tell us. And then also consider the type of pain that puts you through and the type of pain it puts your family through. Smoking is the single worst thing anybody can do for themselves, hands down. Now to obesity. Okay, which is the product of low physical activity and poor diets. Thankfully, Koreans are doing relatively well when it comes to obesity. Here you see our thin Korean chap, yeah, next to the German who's a little bit heavier, and me, the American. Okay? You don't have the same obesity problem that we have.
비교해서
yet.
보았을 때요. 아직 없다라는 거죠.
Here you see obesity prevalence and overweight prevalence.
과체중과
Okay,
비만의
in South
유병률이
Korea
나와 있습니다.
between 1995
한국은
and 2020.
95년에서
All right?
2020년까지
And what
기간
you'll know
동안에
are a couple of
데이터가
things.
나와 있는데요.
Yes, thankfully,
네,
so the difference
보시면
between these two curves
물론 이
is
두 개의
obesity.
곡선의 차이가 바로 비만입니다.
That being said,
자,
the trend is
그렇지만
upward.
트렌드는
So
그래도
over the next 20 years,
우상향입니다.
projections
앞으로
suggest
20년
that
동안
Korea is going to
전망치에
start
따르면요,
facing an obesity
한국도
problem.
마찬가지로
That's a
비만의
product
문제에
of
직면하게
development.
됩니다. 그것은 발전에 따라
The other thing to pay attention to is that being overweight is not itself a very good thing.
과체중이라는 것
Being
자체가
overweight
좋지
also
않죠.
increases risk for
그리고
diabetes, cardiovascular disease,
과체중이
and
되게
strokes.
되면
Okay?
심혈관
So what we're seeing here is that even despite a low obesity prevalence, we have a very high overweight prevalence.
그래도 한국 같은 경우 과체중
I also want to point out the
비교적
problem
높은
with
거죠.
suicide. Okay?
또
On most
자살에 대해서도
developed
말씀을
country
드리고
lists,
싶습니다. 대부분의
suicide is not as high as it is
사실은
in South
자살이
Korea.
한국만큼
And if you look
높은
at the
순위를
statistics,
차지하지 않습니다.
here you
이
see
통계 수치를
suicide
보면요,
rates across the
자살률이
OECD.
나와
And this
있습니다.
is the OECD average here, about 13 per 100,000 individuals
한
die
10만
of
명 중
suicide.
13명이
You see that the average
자살을
suicide
합니다.
rate in South
그런데
Korea
한국의 평균치를 보세요.
is about 3 times as high.
이것보다 세
Now, what's
배가
interesting about
높다는
this is
것이죠.
what's driving the suicide rate in the society is actually suicide among the elderly. And this is an important question that as a society we need to think about. And particularly you need to think about why is it that elders in Korean society are committing suicide at substantially higher rates than in other countries. Now, I want to make a general comment stepping back about public health. And then we can talk about business's role in public health. Public health has been defined by the Institute of Medicine, which is a collection of the most senior doctors and public health thinkers in American society, as what we as a society do collectively to assure the conditions within which people can be healthy. And I want to focus on a couple of words here. We as a society collectively. What that does is it puts public health pretty squarely in the vantage point of government. Most of the time we look to our government to provide and protect the public's health. That being said, there are tremendous opportunities for business, and I want to talk about those right now. But first, why is it that businesses can be such a powerful partner in maintaining and improving the public's health? That's because businesses have a couple of characteristics that unfortunately most governments lack. Businesses are agile. They can move with respect to what's needed to happen. So a lot of these trends, as they come up, business can be the first on the table to be talking about where opportunities sit. Second, businesses are innovative. Governments, unfortunately, for all their good aspects, aren't always particularly innovative about problems. Businesses understand how to make a buck. And in doing that, they can take that mind power and lend it to a series of problems that everybody in society faces. And then lastly, businesses are efficient. Businesses know how to get the best bang for the buck. And unfortunately, governments aren't always that way. So what are some opportunities to do well and do good? First, traditional medical interventions. So we rely on businesses to provide us medical care, to provide us hospitals, to innovate with respect to pharmaceuticals, and to innovate with respect to medical technologies. These are all squarely in the role of business. Okay? That being, and just to illustrate this point, I want to show you antidepressant use between 2000 and 2011 in Korea relative to other countries. Now, I already showed you the suicide rate, which suggests to us that there's an epidemic of depression. Most people who commit suicide are either depressive at the moment or have been depressive. But what this suggests to us is that, unfortunately, despite the high rate of suicide and depression, antidepressant use is relatively low, which suggests an arbitrage opportunity. Providing antidepressant medications to Korean society would arguably decrease depression rates, decrease suicide, and could make the pharmaceutical medical industry money. That being said, medicine is a double-edged sword. Okay? I want you then to think about this as somebody's life course. As somebody walks across their life, okay? At first, they start out as being susceptible to disease. They don't have it, but they're susceptible. They could get the disease. At some point, they have an exposure. That exposure could be smoking their first cigarette, okay? With that, after that exposure, the unfortunate person who's going to get disease, that disease starts out as a pathologic change. There's some change in some cell somewhere that causes the disease in the end. As that change progresses, that person develops symptoms. So let's say to keep with this example, the person coughs blood.
누군가가 기침을 했습니다.
At this point, that's
그런데
alarming.
혈액이 묻어 있습니다.
Only
그럼
then
너무
does this person go see a
놀랍겠죠.
doctor and get a formal
그때가
diagnosis.
되어야지만 병원에 간다는
Here,
거죠.
that person
그리고
has disease,
진단을 받게
and they can
됩니다.
either recover
그러면 질병
with some
진단을
disability,
받겠죠. 그러면은
or pass
회복을
away.
하거나 아니면 장애를 얻거나 사망을
Now,
하거나.
I want you to think about this dynamic with
자,
respect to a medical intervention.
이것을 의학적
We want to
중재를
be here,
대해서 생각을
right?
해보죠.
Ideally, all of us want to be without
기본적으로
pathologic
저희
changes.
모두는 그
Yeah?
어떤
That's where we want our
병리적인
society to
변화를
be
원하지
healthy.
않습니다. 모든
The
사람들이
problem,
다
though, is that
건강했으면
medicine
좋겠습니다.
only makes money
그런데
when people
약을
get
팔아서
here.
돈을 벌려면
because they have to
사람들이
be
이단으로
sick
많이 들어와야
for us to
됩니다.
treat them,
사람들이 아파야지 우리가 약을 팔고
The problem, though, is that
치료하고 돈을
ultimately
벌죠.
that incentivizes disease.
그런데 그렇게 되면은
Because if you're only making money, once people get sick, there's no way you want them not to be sick.
제공을 하는 겁니다. 아주
So the problem
부조리한
with that type of
인센티브
intervention is that it incentivizes people to get sick for us to be able to treat
우리가
them.
돈을
Okay?
벌기 위해서는 이
I want to
사람들
contrast that with a couple of other opportunities. The first is innovative investment models.
그런데
Opportunities
이것과 반대로 혁신적인
to invest
투자
in
모델을
people's
생각해
prevention,
보죠.
okay?
질병
Preventing
예방에
disease in
투자를 하는
populations.
겁니다.
What does that look like?
자, 어떤
One
그림이
example of this is a
그려질까요?
health impact
한
bond.
가지 사례는
Okay? And health impact
health
bonds
impact
occur
bond라고 하는
when people
것이
identify
있습니다.
opportunities to invest in a preventive intervention for
사람들이
which
어떤
there is no
질병
capital
예방에 투자를 할
yet.
수 있는 기회를
So they
포착해서
invest in the
자본
capital.
투자를 하는
Okay?
겁니다.
They roll out this prevention intervention.
기본적으로 자본
It improves
투자를
well-being, and then they
수행하는 것이고요.
recap the
그렇게 되면
savings
웰빙이
that the
높아지고
government or some
사람들의
other payer
웰빙이
would have had to
건강해지고요.
pay
그리고 또
because
의료 비용으로 나갔을
in
법한
the setting of
돈이
the
절감이
disease.
되는 겁니다.
Is that clear? So I want to roll with a case
이해가
study here,
되시나요?
just to demonstrate how this
케이스
works.
스터디를 설명을 드릴 겁니다.
Nearly 20% of children in Fresno, California,
프레스노,
city in the United States, have asthma.
캘리포니아라는요,
Okay?
도시가
Providing
있습니다.
medical care,
아이들의 20%가
particularly emergency care to these children, is supremely and profoundly expensive.
앓고 있습니다.
It costs about
그런데
$35 million
천식 환자를 치료를
annually.
하려면요, 매년
Because these children get sick, have exacerbations, look like they're going to die, and have to go to the emergency room. Emergency care in the United States and almost everywhere is far more expensive than primary care. So figuring out a way to prevent these children from going to the emergency room, and more importantly, from being sick in the first place, could save a lot of money. And there are interventions that can do this. One of them goes into the home of a child with asthma and looks for exacerbants, things that will cause an asthma exacerbation, that child to get acutely sick. And what they showed is by going into the house, clearing things like bugs, latent bug infections, parental smoking, mites, dust, carpets, you can actually save $300,000 per child less than 5 years old. So what happened is a couple of groups got together. The California Endowment, which manages a lot of the pensions for California state workers, as well as a couple of nonprofits, Social Finance and Collective Health, got together and saw this opportunity. And what they're doing now is rolling out this intervention among 200 families in Fresno, with the argument that they can more than recoup their investment in rolling out this intervention in the savings that are had by eliminating emergency room visits among asthmatic children. The last example of this is leveraging shared incentives. Okay? Now, to demonstrate this, I just want you to think through this exercise here. What you see before you, all right, is the profit loss for 4 10-minute smoking breaks for a corporation per person as wage increases. And what you'll note is, let's just say somebody makes $50,000 a year in your company. Just for 4 10-minute smoking breaks. By the way, the average person who smokes far more than 4 cigarettes in a working day. Okay? But just if they took 4 10-minute breaks, this is the loss in profits per year per employee who smokes 10 minutes 4 times a day. Okay? Not to mention the sick days that smokers have to take more than their non-smoking counterparts. Not to mention increases in workers' compensation claims. Not to mention increases in medical costs that sometimes get pushed over into the company. This is just in lost productivity at work. And that's why increasingly American companies, demonstrated by the Wall Street Journal, are taking on these wellness initiatives, opportunities to incentivize good, healthy behaviors in their workers. And not only are they increasing, more and more companies doing so, but you see that the value of these packages are increasing as well. In fact, those companies that have been studied have demonstrated that actually make money on these wellness programs. Investing in workers' wellness, as shown in the Mayo Clinic, actually saves tremendous amounts. And what you'll see here is $464 in savings per worker annually in the Mayo health system. just by rolling out a suite of wellness initiatives. Okay, and Johnson & Johnson estimated, it was one of the biggest corporations in the United States, they estimated that they made $2.17 per dollar they invested in wellness programs. That's serious money. Now I want to end with a quote. Charity starts at home. Okay, that means that if you want to do something good for somebody, you should do it for somebody who's close to you, right? But this is not charity. These investments can actually make money. And so I want to push this forward and just say that investment starts at home. We have opportunities to invest in our workers, right, to promote their health. And the incentives all align. You improve your workers' health. You make money as a corporation, and you support your society that's working to promote the public health. This is a smart investment. And my message to you as a health scientist is to say that you should be thinking about the well-being of your people and opportunities that you have to invest in making people better. It's the ultimate social good. Thank you.